Just over 1 million COVID vaccines are now in Kansas, a milestone after just passing the one-year mark from the first positive coronavirus case in Kansas. And tonight, and We Together, a coronavirus discussion. We bring in the experts to answer your most asked questions. That way you know what to expect. And thank you for joining us tonight for our special. I'm Brooke Ludington. For months now, we've been asking for you to email us in your questions that you have on all things coronavirus. And week after week, the emails just keep rolling in. And joining me tonight to answer all of your questions is Dr. Cliff Jones from Topeka's Stormont Vail Hospital and Dr. Marcy Nielsen, Chief Advisor for COVID-19 Coordination for the state of Kansas. And I want to thank you both for being here with us tonight. And Dr. Nielsen, for folks at home who may be meeting you for the first time here tonight on this program, can you describe really what your job entails and how you play a vital role in making sure that the state gets the COVID vaccines that they need?
You bet. Well, as the governor's chief advisor for coronavirus coordination, my job is to ensure that all the various very important pieces of addressing this crisis are cohesive and coherent and that we're communicating clearly with the public. This is a very anxious time for our country and for our state. It's a very frightening time for individuals, and the more that we can do from the state's perspective to ensure that everybody understands all the things that the state is doing on their behalf to keep them safe, the better off I think we'll all be. So my job is mostly to do that and to work with all of the cabinet secretaries, to include Secretary Dr. Norman, and with the healthcare providers across the state that are working so hard to take good care of us.
And one thing I did want to ask you as well, the state announced last week that we would be receiving the Johnson & Johnson's COVID vaccine at some point this week. Can you give us an update on if it's already arrived here and what parts of the state might be getting it first?
You bet. We did receive the Johnson & Johnson vaccine last week. We got a little more than 23,000 doses. We were thrilled. Having the J&J vaccine is really going to be a game changer for the United States. Now, this week, we got a pretty good infusion of vaccine. We spread it all over the states. I think most folks recognize that we work very closely with local public health departments when it comes to distribution of the vaccine. We're going to have a week or two where we're not getting vaccine from Johnson & Johnson. And then the following week, we expect to get a very sizable shipment. And again, that's going to mean more folks across the state are getting access to the vaccine that they've been waiting so patiently for.
And I know a lot of people are probably excited about that one because it's only a one-dose vaccine compared to Pfizer and Moderna's with the 2 doses. Now, real quickly, while we're talking about the vaccines, I do want us to review the latest vaccine numbers. The state reports that more than 1 million doses have been distributed across Kansas, and nearly 700,000 vaccines have now been administered in the state, with 465,000 people in Kansas receiving at least their first dose and more than 230,000 receiving the second dose. And yesterday officially marked the one-year date since Kansas has had the first COVID-19 case. And I checked the state health department's latest numbers earlier today for positive cases, and their numbers showed there's been a little over 295,000 Kansans that have tested positive for COVID-19. So I'd like both of you to answer this, starting with Dr. Jones. What do you feel is the biggest thing we have learned in the last year?
So anticipating the direction this would go, the way it would affect us, was all this anticipation starting a year ago at this time when we knew it was in the United States and we were first seeing initial cases in the state of Kansas and waiting for our first cases in the hospital. Kind of a sense of dread, a sense of disbelief. People that had been involved in my career in infectious diseases management and diagnosis for many years had never really anticipated that it would actually ever happen like this. And so again, our experience followed the local version of the pandemic and the different peaks as surges occurred in the spring and surges occurred in the summer, a surge in the fall, and then the largest surge that we experienced in early December. And again, I do remember how we felt in early December, seeing the numbers continuing to climb, being absolutely certain it could only get worse through the end of the month and through the beginning of this year. And then sort of surprisingly, things started to taper off. So I guess if there's anything that I could say that we've learned is that it's unexpected and kind of difficult to forecast exactly where we would be at any particular point in time. We have learned a lot about the value of common sense things that we've been talking about in infection prevention for my whole career. Starts with basic hand washing, distancing, staying away from people who are ill or keeping distance from people who are ill, and the tremendous value of face mask protection. Again, some skepticism about this, there still is some, but clearly it's made a huge difference, and it's making a difference right now.
And Dr. Nielsen, what is your one-year takeaways?
I would take away from this that we are really a global society now. We think so much about our ability to protect ourselves here in the United States, and what we learned was a pandemic affects all of us. I think we thought that the United States would be better prepared, but candidly, we have been underfunding public health my entire career, and I've been at this for 30 years. I think what we've learned from the perspective of individuals and families is we really need one another. This is such a frightening time, but it's also a time that I think we've been able to see what's really valuable to us. I worry a lot about our mental health, and I think we are seeing that this is a pandemic that has impacted a disease and an illness that impacts our physical health. But social isolation and anxiety is really impacting our mental health. And we too have much to do to fix our broken mental health system. So what I've learned this year is that we need each other, that we need a healthcare system that is stronger, and we need to understand we are part of a global environment that needs to prioritize public health.
Yeah. Certainly has made a lot of us, maybe rethink a lot of things. And I know the biggest reason why all of us are here tonight is because viewers, the people here watching at home right now, they've got so many questions, even after a year of going through this. So I do want to get to those viewer questions before we go on for too long. So for the record, though, I want to say that I've personally gone through all of the questions that we have received here in the last week at KSNT. And tonight I will direct a question to either Dr. Nielsen or Dr. Jones, but please know that both of you are more than welcome to answer or add your expertise after one another. I know that we've got the studio lights and cameras and all this stuff going on in front of us, but I'd like this to be a conversation as much as possible. So please feel free to hop in whenever. So starting with our first viewer question tonight, RULA says that she is in phase 5 of the vaccine plan. And now with the approval of the Johnson & Johnson vaccine, she wants to know whether she will be able to choose which of these 3 vaccines she will get, or will she just get whichever one is available at that time? Dr. Nielsen, we'll start with you on this one.
Well, what we're hearing most physicians tell us is the vaccine that you should get is the vaccine that you have access to, and I would want to underscore that. Having said that, it's a personal decision that each of us will have to make, and if there is a preference that folks have for a certain vaccine, I recognize that it will be important for them to talk to their healthcare provider and make the best choice for themselves.
All right, and Dr. Jones, Linda wants to know, if she had coronavirus and the first shot of the vaccine, does she need the second vaccine?
Really good question. Right now, the answer is yes. The data is enticing as far as the immune response to the single first dose of the COVID-19 vaccine after natural infection. So there is an intense response, but it just hasn't been studied. So the current recommendation is to complete the series of 2 vaccines.
And I know it's very early on, and either one of you can jump in here on this one. The Johnson & Johnson vaccine, I know we just got it in the state this week. Have you heard of any side effects from people who have gotten that 1 dose?
I believe it's such limited exposure to it as far as the people in our population, but I think the side effects are very similar to those experienced with the Pfizer vaccine and the Moderna vaccine.
That's my understanding as well. Kind of flu-like symptoms, a little achy, but in general, pretty minor side effects.
All right. And Dr. Nielsen, John, he wants to know, when will vaccines be available to those under 65 with medical conditions that have compromising health issues?
We hope very, very soon. Right now the state is in phase 2, and phase 2 is for individuals who are over the age of 65, those who live in congregate settings, and those who are in high contact critical worker positions. Next is phase 3 that will include individuals between the ages of 18 and 65 with serious medical conditions. We have heard and recognize the frustration that those individuals feel, the concern they have that they're not yet vaccinated. But as I'd mentioned, the Johnson & Johnson vaccine coming to market will be a game changer. There are 2 additional vaccines that we expect to get emergency use authorization soon. And the more vaccine we have on the market, the faster our ability to get through any specific phase. We are hopeful, we are optimistic that it will be the end of March, the beginning of April, and we'll be able to move into phase 3.
And just to be clear, if a county, let's say, I think Stanton County, I was reading in the newspaper last week, Stanton County, Kansas, out in my neck of the woods, out in western Kansas, they were allowing folks to go to, I think, their local 4-H building and get the vaccine. There was no appointment needed, didn't matter what age you were, and to get the vaccine. My understanding is that's not something you guys are wanting to do. You're wanting the state to move on county by county at the same time.
We are, and I recognize that the last thing we want to do is waste a single vial of vaccine. So we certainly have said to local health departments and providers, if for some reason you are going to have a vaccine that's going to go unused, we'd really prefer you to find somebody to give it to. Having said that, looking at the issue of equity and wanting to make certain that all the counties throughout the state are trying to get the vaccinations to people who are within a given phase, we have set the guidelines and asked counties to prioritize populations within a phase, but not outside of a phase. To be fair to Stanton County, I'm not sure that the guidance was as clear as it should have been, and we've made it more clear.
Very understandable. Hey, and I want to get to one last viewer question before we take a quick break here. So Bernice asks if any current data shows if any of the vaccines cause heart problems, leg or arm paralysis, or something worse. And Dr. Jones, I'll have you answer this final question before we go to break.
No, there isn't current data that would suggest that the arm or leg problems or heart problems are associated with the vaccine. The common side effects of the vaccine are local at the site of injection. Some small proportion of people will have minor allergic reactions. A few people have more severe allergic reactions. The vaccines are new. We're talking about 3 months into large-scale vaccination where tens of millions of people have been vaccinated across the country, and so far there hasn't been any definitive or scientifically observed increased risk of any of those kinds of problems.
And when you mentioned the severe, some people have severe reactions. One thing I did want to ask you about is, I'll just use my husband as an example. He's a physician's assistant. He never tested positive for coronavirus, but the second day after he got his second dose, he was just feeling miserable, you know, and I thought for the first time ever that the man was going to take a sick day at work. He didn't. But for folks who maybe, you know, don't know that balance of, you know, am I really sick or should I go to the hospital? I mean, what do you recommend? At what point do you say, hey, you just got to tough it out for this day, or hey, yeah, you should actually go to the local ER?
I think most people would not require a trip to the emergency department for those kinds of symptoms. So flu-like symptoms that last 1 to 2 days, usually the second day after the vaccination or the first day after the vaccination, are self-limited and they will respond to simple medications. Again, if an individual has severe symptoms or high fever that's persistent, a couple of things would have to be considered, including the possibility of COVID-19 infection. So again, call before you go, but have a conversation with a healthcare provider if symptoms are severe.
All right. Well, we are going to take a quick break here, but don't worry, we're just getting started. After the break, we'll dive into what's recommended for people with rare health conditions. Should they get the vaccine? We'll find out next.
We Together, a coronavirus discussion sponsored by Stormont Vale Health. Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
The Sumatran tigers are among the most endangered. There are fewer tigers in the wild than there are in captivity in North America. Every glass of Tiger Bite IPA supports the Sumatran tigers at the Topeka Zoo, so come on out to the Blind Tiger and buy a beer, save a tiger.
Blind Tiger, always brewing up something great. Blind Tiger Brewery and Restaurant, 37th and Kansas.
Hi, Clay Sherwood, President of Swims and Sweeps. I'm here with Frank and Dean, the CEOs of Cute, and we're here to show you our pool that we built. You need to go to our website at swimsandsweeps.com or on our Facebook page and check out the other pools that we build. We build above ground pools and we build in-ground pools. And don't forget, after we build your pool, we'll help you take care of it with the Pool Life exclusive collection, the most brilliant clean ever seen. We're here to take care of you and your pool needs.
Welcome back to our coronavirus special discussion. Tonight I am joined by Dr. Marcy Nielsen, Chief Advisor for COVID-19 Coordination for the state of Kansas, and Dr. Cliff Jones from Topeka's Stormont Vail Hospital, both helping answer your questions that you emailed in to us. And I don't want to waste any time, so let's get right after it. This question comes from Judy, and she asks, since the flu shot can cause the side effect of Guillain-Barré in rare cases, is that something that is a possibility with this COVID vaccine? So Dr. Jones, is that something that needs to be avoided for people at risk or history with Guillain-Barré?
So that's been a concern that's been raised by our patients. Guillain-Barré is not terribly common. It's most commonly associated with a natural occurring infection, either gastrointestinal or lower respiratory. I think 1 in 100,000 is the risk overall for the population. There have been situations with certain influenza vaccines in years past where there was a slight increased likelihood of developing Guillain-Barré following vaccination. So the original that most people remember is the swine flu vaccination, which was in the 1970s. Then there was a slight, very, very slight increase with the H1N1 vaccine a number of years ago. There has not been shown any increased prevalence with the COVID-19 vaccine. There hasn't been shown to be a risk of recurrent Guillain-Barré with future subsequent vaccinations for individuals that recovered from previous Guillain-Barré. So as far as anybody knows at this point in time, that's not a contraindication. And it will be followed if an individual develops Guillain-Barré during this year of COVID. Is it related to the COVID-19, which is possible? Is it related to the vaccine, which we can't say is impossible? But so far that hasn't been seen.
Okay. And our next question comes from Mike. Dr. Nielsen, I'll have you answer this one. Mike says that he is 63 years old with underlying health issues, and he wants to know why a teenager that works at a restaurant is prioritized in the vaccine plan.
Yeah, it's a question that we get a lot. Folks don't understand the phasing process, and it really was very deliberate and extremely thoughtful. First, scientists who advised the Centers for Disease Control spent multiple sessions with bioethicists and statisticians, other physicians, looking at what the risk was in getting COVID-19, getting the illness, and what the risk of death was. And then they prioritized which individuals should go into which phase based on both the risk of catching and dying from the illness, but also spreading the illness. So when you think about folks who are in phase 2, and I'd mentioned earlier, those individuals who are in high contact, direct care types of positions, you'd mentioned a teenager who's a grocery store worker. They are exposed to the public, and so they are both at risk for getting the disease, but in particular, they're also at risk for spreading the disease. So those individuals were prioritized both by the Centers for Disease Control, but also by the state of Kansas. Kansas, like the CDC, pulled together a group of experts to include physicians, bioethicists, and folks from all across the healthcare community to put our phases together. We do recognize that people are very anxious to get the vaccine, and the phases don't make necessarily overt sense when they first look at it, but think about this as the population health risk as well as an individual's risk.
And one thing I wanted to ask you real quickly, so let's just take an example, someone like myself, about to turn 30, moderately healthy, could always exercise more, eat better. I mean, of course, I think we're all maybe guilty of that at times, but when would basically the average person in Kansas be eligible to get the vaccine at this rate? What's the state's projections?
You would either be in phase 4 or phase 5, depending on your individual circumstances. What we hope to be true is that there is enough vaccine to go around for all Americans by the end of May. We've heard that from the White House. Now, I don't think that means we'll have shots in arms by the end of May. So we will be anxious to get as much vaccine as Kansas can possibly get each and every week. We are hopeful and certainly working hard to hope that we can get the vaccination into everyone's arms by the end of the summer into the fall.
All right. And Dr. Jones, Torrey wants to know, when social groups for senior citizens reopen, is there any health benefit in requiring everyone to have been vaccinated? I know I've heard about this at some nursing homes where maybe some people have declined. Is that going to be a problem for those who have been vaccinated?
I think a lot of individuals, people in healthcare who, peers that I have who've had access to the vaccine, we have felt more comfortable in small group socialization where all parties in that small group has received the vaccine. I think in long-term care facilities where access to the vaccine was provided early on, one can hope that the vast majority of individuals in those settings have been vaccinated. There's still so many things we don't know about asymptomatic infection and transmissibility, so it's known that the current vaccines provide tremendous protection in preventing symptoms, and amazing, outstanding prevention in avoiding hospitalization. But is there still some level of transmission? So the advice that we're giving and that we're trying to live, is continue to use common sense. If you're sick, stay home, get some evaluation for your illness. If you're in a social situation, it needs to be a relatively small social situation, and parties really need to be wearing their face masks and keeping what distance they can possibly keep.
And any concerns right now with these new variants that we have seen popping up? You know, the UK one seems to be the one we hear most about now. Any concerns that they might cause issues? I mean,
it's an assumption that it's an expectation that the UK variant may be the most common strain in the United States at some point this spring. It still barely made a foothold in Kansas, I think 14 cases, if I remember that number correctly. Is that going to change? In Europe, in Great Britain, it appears to be more contagious. Fortunately, the studies so far show the vaccine provides protection against that strain. But that is something that's changing. That's a potential risk for another surge as it gains a toehold, and we still have the majority of our population has not been vaccinated. So.
All right. We are going to take another quick break here, but don't go anywhere. We'll go to the key takeaways all of us need to know next.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Stormont Vail Health, Heartland Healthy Neighborhood, and the Shawnee County Health Department need your input. As part of the Community Health Needs Assessment for the residents of Shawnee County, an online survey is available for you to provide feedback about the health needs affecting you and your family. The survey takes less than 10 minutes to complete. All responses are confidential. Help us meet the needs of those in our community. Stormont Vale Health, Heartland Healthy Neighborhood y el Departamento de Salud de Shawnee County necesitan su ayuda. Estamos ofreciendo una encuesta digital que nos ayudará a entender cuáles son las necesidades de salud suyas y de su familia. Esto es parte de un asesoramiento de necesidades médicas y de salud para los residentes del condado de Shawnee. La encuesta toma menos de 10 minutos y todas las respuestas son confidenciales. Ayúdenos a cuidar de las necesidades de salud de todos en la comunidad.
Hi folks, this kitchen was recently completed by Window Design Company. We removed the outside wall and added 160 square feet with a sloped ceiling and skylights. We also removed the wall between the kitchen and living room to create an open concept. We also installed this island and cooktop with a beautiful pantry and many other cabinets. So if you're thinking about remodeling, give us a call today. We are your home remodeling specialists.
I think we have similar style.
Okay.
When Blake wants an artist,
What's the matter with you?
the sky's the limit.
My girlfriend loves reggae.
Wouldn't it be great if she were here to coach you?
The Voice tonight and tomorrow on NBC.
Monday's new hit has landed.
The debris started falling 6 months ago.
Your daughter is inside the square. We all have the right to know the truth.
Debris, all new tonight on NBC.
We are back for our final few minutes in tonight's coronavirus special. And before we get to our final thoughts and takeaways, I have one last viewer question for both Dr. Marcy Nielsen and Dr. Jones. So Deanna wants to know how she can get a card confirming that she's received both doses of the vaccine. And Dr. Jones, I'll let you start.
Stormont Vale, you would need to ask for that card. We made a decision in December because we were allowed to upload the vaccination information electronically into our medical record and into a statewide depot of information regarding vaccination, that we would not issue the written cards, but they are available, so you could ask for a card if you need one, and we can supply you with one.
And Dr. Nielsen, do you know if there's a state protocol that the state is trying to follow with this?
Those cards are actually from the Centers for Disease Control, and it is optional for the healthcare providers to give them, but I think if a person is comfortable, they should definitely ask for them, and my understanding is many places that are providing vaccines are also giving out those cards.
Okay, and for our final question tonight, both of you, can you just say what you want people to take away from our conversation here tonight? Could be something that we've already talked about or that we haven't yet. Dr. Nielsen, we'll start with you.
The one thing that I would encourage folks to think about and understand is that science is ever evolving, and this is a new disease that the world has never seen. So when you hear that scientists say, for example, don't wear a mask, and then you hear do wear a mask, that is based on research that lets us know as scientists what is the most important information based on the evidence. So the debates that we have about listening to the scientists don't really need to be debates, because science will change. We will learn more about this disease, and we will do our very best to keep everyone safe.
All right, and Dr. Jones, real briefly, your final thoughts as well.
It's very similar. The things that we've learned over the past 11, 12 months, we can look back in hindsight and see what we were advising, what we were recommending, what we were requiring in April and May. And 3 weeks later, 4 weeks later, we had to expand on what we were doing, things that were based on fear, anxiety, and lack of knowledge. Science has caught up with us for the most part, and we're still learning and still evolving and still changing. And the good news is the vaccine is out and is going to be more and more readily available, and it's going to provide significant protection.
It's made all of us very, very flexible. I want to thank both of you so much for taking the time to answer all of our questions tonight, for taking time out of your busy lives to be here with us. And I want to thank you, those of you at home watching this right now. We appreciate you sending in all of your questions, and we don't want you to stop. If your questions didn't get asked, don't worry. I personally have a folder with all the questions being emailed in. Just send them to us at KSNT Coronavirus. Have a good night.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vale Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vale Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.